Hi there, welcome back. My name is Laura Wilson. I'm a student physical therapist, and today I'm going to be providing you some education on urinary stress incontinence, urge incontinence, as well as how your pelvic floor muscles can contribute to constipation and help with the management of fecal incontinence. Let's get started. So first, stress incontinence is actually the most common type of urinary incontinence. It causes you to leak pee during physical exertion. So whether you're exercising, coughing, sneezing, or even laughing, you're peeing. Stress incontinence happens with sudden pressure on the bladder and the urethra. Remember, the urethra is this tube that carries pee from the bladder out into the body. This pressure causes the sphincter muscles inside the urethra to briefly open, allowing pee to come out. Now, unlike stress incontinence, urge incontinence is when you have a sudden, intense urge to pee, followed by an involuntary loss of that pee. You might also be feeling like you need to pee more often or even more throughout the night. So the bladder muscles basically squeeze and contract at the wrong times, and they happen no matter how full your bladder is. Most women who have urge incontinence also get the diagnosis of overactive bladder syndrome. So a helpful strategy for suppressing that urge suppression, is going to be when you feel the urge to pee, stop, take a deep breath, sit down if you can, contract those pelvic floor muscles 3 to 5 times, take another breath, and then ask yourself, do I still need to go? If the answer is yes, then walk calmly to the toilet and relieve yourself. So, on that note, fluid recommendations. So, let's say, for example, I have a patient who is 140 pounds. I am going to divide that number by half, which is going to give me 70. That tells me that somebody who weighs 140 pounds is going to need to consume 70 fluid ounces of water to maintain those daily recommendations. So whatever your body weight is, divide it by half, and that's how much water you should be drinking. It's tough, but I keep a 40-ounce water bottle by my side at all times, and I drink 2 of those a day. Based on my weight, that is about the appropriate amount for me to be consuming. Just something to think about. Another thing that we want to talk about are bladder irritants. A bladder irritant is any food, drink, or medication that causes the bladder to be irritated. An irritated bladder can cause you to feel like you need to pee more often. So some of the common irritants are going to be coffee, tea, acidic things like lemon, pineapple, grapefruit, carbonated beverages, carbonated water, soda, spicy foods, tomato-based foods, dairy, chocolate, artificial sweeteners, and alcohol. So if you're already experiencing any kind of incontinence or feeling like you need to pee way more often, try reducing or eliminating some of those items from your daily food, drink intake and see what happens. So since we talked about urinary incontinence and things like that, now I want to talk about bowel dysfunction and fecal incontinence. Typically, patients who are constipated or have fecal incontinence are going to have a higher rate of lordosis. Lordosis is that inward spinal curvature, so where your back is like super curved inward. They'll also have increased pelvic floor muscle tone, so meaning the pelvic floor becomes too tense and it's unable to relax. They'll also have the increased activation of that the puborectalis muscle, which is here within that levator ani group. Remember that U-shaped sling that we talked about? So on that note, I'd like to talk to you a little bit about proper bowel management strategies, including fiber intake, time toileting, excuse me, bowel massage, and even the position. So like the position that you're in on a toilet to help poop come out more easily. Let's start with fiber. So you should be consuming half of your body weight in kilograms per day of fiber. So you take your weight, divide it by 2.2 in order to convert it to kilograms. So we'll use our 140-pound patient for an example. 140 pounds divided by 2.2 is going to be approximately 63. Divide that by half and you get about 31 to 32. So a 140-pound patient is going to need to consume 31 to 32 kilograms of fiber every day. Mix your fiber intake. So there's soluble and insoluble fibers. Soluble fibers attract water and it turns to gel during digestion. This causes digestion to slow down. So things like beans, lentils, peas, nuts. Then your insoluble fibers add bulk to your poop to help food pass more quickly through your stomach and through your intestines, like wheat bran, whole grains, and vegetables. Normal bowel movements occur usually every time you eat, 2 to 3 times a day or every other day. If you're straining more than 25% of the time, or if you're having less than 3 bowel movements per week, you may be experiencing some abnormal bowel movements or constipation. Getting into constipation, something fun that I like is bowel massage. So bowel massage, I'm going to use this model here. It's not in the exact location, but I'm going to kind of show you where it's at. Bowel massage helps stimulate peristalsis. So you're going to move in a clockwise motion in small clockwise circles through kind of your small intestine area here. This is going to help stimulate peristalsis, which peristalsis is the involuntary contraction and relaxation of that anal canal. This is going to help decrease the amount of time it takes to get poop out, as well as increase the number of times you're pooping if you're constipated. It's also going to help decrease any uncomfortableness or pain that you might be feeling if you are constipated. So when you're constipated, try bowel massage. It does work, I promise. Another thing that I want to talk about is toilet positioning. So yes, how you sit on a toilet. Your anorectal angle from my last video was between 80 to 100 degrees. That's the normal anorectal angle when you're pooping. Using a squatty potty is putting your feet on a stool that helps increase your hip and knee angle. So it allows that opening to kind of open up a little bit more, allowing your poop to come out a little bit more easy. Don't knock it till you try it. We want to increase that angle of our hip and knees. So takeaways from today: bladder irritants, try to avoid them or reduce them. And then things to help you poop: make sure you're consuming the proper amount of fluid, fiber, and toileting positioning, and give yourself a good bowel massage every now and then. I hope this video has been fun and educational. Thank you again for listening.